Hi there, welcome to a presentation by CBH Education in our Pharmacy Revision series. Today we're going to be talking about the aminoglycosides. Now, commonly the aminoglycosides that you'll tend to see are going to be in hospital only, and on your placements, gentamicin is the most common one that you tend to see. Now, these work by binding irreversibly to bacterial ribosomes, a 30S subunit, so inhibits protein synthesis. So therefore, it stops obviously the replication of the bacteria. So the action is bactericidal. Side effects include ototoxicity and nephrotoxicity, and then obviously the key monitoring is the serum concentration. Now, this drug is under therapeutic drug monitoring. So when you come under therapeutic drug monitoring, some of the aspects that you may be asked is understanding some of the reference ranges associated with the serum concentration, which is covered in the next slide as well. We will be going through things like SPCs, how to decipher the information as well. And obviously another aspect is prescribing in renal impairment as well, which is very important in relation to this as well. So this drug will obviously come up with your renal aspect of prescribing and obviously reviewing the patient and aspects such as creatinine clearances as well, where you may be tested on this question. Right, next is talking about the MHRA warnings. So you've got the potential for histamine-related adverse drug reactions with some batches. So obviously here it's monitoring drugs known to cause histamine release, and obviously again the warning with patients with renal impairment as well. Now, prescribing in patients with mitochondrial mutations, this is where the drug is prescribed as in the ear. So obviously gentamicin does come as ear drops as well. And another thing here that comes up with antimicrobial resistance in the community is patients with ear infections. So if you work in a GP practice, especially, or a pharmacy as well, community pharmacy, some ear drops are out of stock at the moment. While obviously talking about this presentation, there are some preparations which are out of stock, and obviously patients we're looking for alternatives. Now, what you have to make sure is obviously before you recommend an alternative, if the prescriber has done a sample and has it come back resistant or not or sensitive to the causative organism. So obviously, in some cases, from a safety perspective, the organism might be resistant, but those specific ear drops might be out of stock, and this is where you have to find your alternatives. So it's really, really important to check if a patient had like a swab sample taken, to obviously identify which antibiotics were sensitive or resistant, because from a practice point of view, you could then obviously give an alternative, and then what would happen is the patient would not respond to treatment. That's the most important bit. Now, another aspect is making sure you understand the serum concentrations as well. So obviously the multiple dose regime should be 5 to 10 microgram per liter, and then obviously pre-dose trough should be 2 milligrams per liter, and then looking at the indications as well, like for endocarditis. So this is really, really important here with the therapeutic drug monitoring. And obviously, if you do get a question, you've got to find this information in the SPC as well. And this is obviously where we'll do a session on looking at aspects of the SPC and applying this to some of the pre-registration questions that you may find in your exam and even in your OSCEs as well. Thank you very much for listening to this presentation by CBH Education. For further presentations on OTC medications, OTC conditions, pharmacology, further drugs, the legal aspects of prescribing, and even OSCE support as well, please follow us on our Facebook, Instagram, and YouTube channel.